Today I'll be presenting the correlation of adverse effects of cisplatin administration in patients affected by solid tumors, a respective evaluation by Ostolfi, Laura, and others. Cisplatin is a platinum-based compound that is useful in treating cancer. And cisplatin is used to treat children in terms of hematological tissues and for adults in solid tumors. And cisplatin is used upon patients, the patients display increase in tissue accumulation and plasma levels. The plasmas do not get out of the body readily. According to a research, half-life of a plasma level of cisplatin is 28.5 months. However, the plasma level of cisplatin differs by tissues. The half-life will get shorter as the tissues regenerate rapidly, but in contrast, if the half-life will get longer as the tissues regenerate more slowly. Also, the plasma levels differ by persons, as the plasma levels are influenced by several factors such as the cumulative dose, glomerular filtration speed during chemotherapy, use of sodium thiosulfate during cisplatin chemotherapy, method of administration, follow-up time, or the age of patients. Also, cisplatin gets out of the body through biliary clearance, which accounts for the 10% of letting the cisplatin out, and urinary clearance for 90% of getting rid of cisplatin out of the body. Now, cisplatin displays several side effects: fever, hypothermia, altered sleep-wake cycles, myelosuppression, alteration in the liver, skin, respiratory apparatus, accounting for the common symptoms of cisplatin. Also, gastrointestinal symptoms are the most common, as 90% of the patients show symptoms such as vomiting. And in severe cases, there's neurotoxicity, nephrotoxicity, and ototoxicity. And there are several factors in side effects. There's dosage, administration, skin pigmentation, age, diet, blood pH, interactions with radiotherapy. Also, when patients repeatedly exposed to cisplatin shows resistance to cisplatin, there are several methods, which includes the reduction in the intracellular drug accumulation, drug inactivation by the cytosol, changes in DNA repair mechanisms, and alterations in proteins involved in apoptosis. The different compounds studied for interference with cisplatin toxicity include sodium thiosulfate, methionine, vitamins, CNE, ginkgo biloba extract, and dexamethasone. The purpose of this research is to evaluate the incidence of side effects in patients with different types of tumors undergoing chemotherapy with cisplatin. Records of the patients retrospectively examined or heterogeneous in order to verify whether various chemotherapy combinations increase the sensitivity of the organism to toxic effects of a drug, whether a direct correlation could be detected between the tumor site and a specific side effect, finally, whether the side effects were reciprocally related. The research was administered on 123 patients at Clinical Oncology Unit St. Anna University at Hospital in Ferrara, Italy, and this was a 6-year research done through 2007 to 2008, and the patients had a wide range of cancers, which included lung, head, neck cancer, gynecological cancers, melanoma cancer, thymoma cancer, gastric cancer, neuroendocrine cancer, urothelial cancer, hepatic cancer, occult cancer, thyroid cancer. Also, in terms of treating the patients, the patients were treated with cisplatin alone or with gemcitabine, urspin, etoposide, 5-fluorouracil, darcapazole, vinorelbine, or in a combination called EDC, which involved EPI-CDP, which was a mix of EPI-CDP, vincristine, cyclophosphamide. Also, when cisplatin is administered with GEM5 FU or EN, additional administration of dexamethasone is required, and when therapy follows the deoxy scheme, the amount of serotonin is doubled as well, preceded by hydration and by intermediate treatment with dexamethasone and serotonin. Although the daily standard of dose of dexamethasone is 20 mg, in most cases the prescribed daily dose was 8 mg in 100 milliliter of saline. The administration of chemotherapeutic drugs was also preceded by the administration of two diuretics. Among the 123 patients, 63 were also treated by radiotherapy, particularly when affected by head and neck tumors. In terms of when we define the side effects, we see the side effects that infect the auditory ear, the blood, bone marrow, constitutional symptoms, dermatology, skin, gastrointestinal, hepatobiliary, pancreas, neurology, pulmonary, upper respiratory, renal, genitourinary, sexual reproductive function, changes in sleep, wake cycle, which is a symptom categorized separately. Now, moving on to the results. For all data, the average value and standard deviations Now, looking on the results, which focuses on the patient characteristics, the mean age of patients was 60 years old with a deviation of 9.2 and a range of 35 to 81 years. And thyroid and gynecological tumors were displayed in females only, while gastric carcinoma was displayed in males only. And the highest prevailing cancer among both genders were lung and head and neck cancer. Interestingly, these cancers were displayed among or distributed among males and females with a ratio of 4:1. The third most frequent tumors in women were gynecological tumors, and besides the tumors mentioned above, cancers, the range of infected individuals of other cancers were 2 to 5. Now moving on to the result of chemotherapy protocols and adverse effects. Okay, analysis of the average daily doses administered revealed that the most intensive therapy was applied for lung sarcoma tumors, followed by SLC and neuroendocrine tumors. The lowest daily dosage was administered to patients affected by thyroid tumors, followed by patients affected by uterine and vulvar tumors. The patients receiving a higher CTDP dosage were affected by neuroendocrine, followed by those affected by urothelial tumors and CLC. The patients receiving the lowest cumulative doses were those affected by ovarian tumors. Finally, doses below 100 milligram per square meter were administered to the patients with uterine, gastric, vulvar, and thyroid tumors. Also, the plot displayed here displays the number of toxic effects against cumulative and daily doses of cisplatin administered and correlates these doses with the associated compound with the adverse effects. The cumulative amount of cisplatin is directly related to that of number of adverse effects. Those also affected the apoptic and homological systems, as the independent factor and dependent factor displays a positive linear relationships. Now moving on to the result that focuses on the tumor site and side effects. Now looking at the figure, no side effect is common to all tumor classes, and the most frequent side effects is gastrointestinal toxicity, constitutional systems, and hematological toxicity. Following analysis of the number of side effects detected for each tumor class, we can note that the toxicity range is higher in individuals affected by lung cancer, while in those affected by thyroid and apoptotic cancer, the number of side effects is lower. Now moving on to the result, which focuses on the relation of side effects. Dermatological disorder is related with cytolytic disorders and hematologic toxicity. Gastrointestinal disorder is related with respiratory disorders and octotoxicity, and genital apparatus disorders is associated with octotoxicity and apoptotic toxicity. Overall, neurotoxicity is associated with sleep-wake disorder, and together with constitutional symptoms stand out from all other groups. In conclusion, main factor influence the occurrence and severity of adverse effects is the dosage of cisplatin administered both for single and cumulative doses.